Welcome back to another week of the Let's Talk Social Innovation podcast, everybody. I hope you've had an amazing start to your week, but if not, we can kickstart that right here. I'm your host, Ian Gahende, and this week, y'all, season finale of season 2. Who better to have on than who I would call sort of the brains behind this operation, Mary Angbanzan, the Outreach and Engagement Coordinator for the David C. Frederick Honors College Social Innovation Program. Also, the honors degree commencement speaker at graduation.
You know what it is.
How we doing?
I'm doing good. How are you?
I'm doing pretty good. This has been a long time in the making, obviously. You have some podcasting background. And it's like, this should have been something way earlier than it is.
Honestly, it's crazy because, I remember when you came to Ron and I literally was like, wait, I had a podcast. And I don't know. I think part of it is sometimes we forget our background. Or I don't know, you kind of get lost in the weeds. And sometimes, especially in higher ed, I think that it's easy to feel like certain things like a podcast or things don't belong in a sense.
Mm-hmm.
So I don't know, and I think that's what social innovation really to me has done is broken those academic higher education barriers and boundaries. Let's push the boundaries a little bit more. You know what I mean?
Oh, for sure.
Be different. Yeah.
Anyways, y'all, this week's season finale, we're going to be talking about Mary's background and upbringing, her journey through different schools, how she got to Pitt. Everything that she does at Pitt, y'all, it's a lot. And then in the second half, we'll be getting into maternal health care. But anyways, everything else out of the way, let's just get into the meat of it, Mary. Take me from the beginning.
Sounds good. Oh, take me from the beginning.
The beginning.
So you want to know where I was born?
Everything.
Okay. So I was born in Fort Collins, Colorado. My parents, Rosine and Alain. My parents are from the Ivory Coast. My mom came here in 1990 something. I forget what year. It's probably 1996, probably. My dad came shortly after. My mom was here for a little bit, and then she decided to get her master's. And she ended up applying to CSU's program, Colorado State University. So that's how they ended up in Fort Collins. And a couple months later, they sat there and they found out they were pregnant with me. So yeah, and then I was born, lived in Fort Collins, I want to say maybe for almost a year. And then we moved to Denver. I grew up, my whole life I grew up in Denver, lived in Green Valley Ranch for most of my life. I want to say we've lived in Green Valley Ranch for closer to 16, 17 years. So most of my life, we lived in Green Valley Ranch. My brother was born. He is a 2004 baby. Aren't you a 2004
No,
baby?
I am not a 2004 baby.
Oh, wait. Oh, you're a little bit older.
Yeah.
So then lived in Green Valley Ranch. I went to Catholic school my whole life. I actually started at this school called St. James, went to preschool there. And then I went to St. Pius X, went there from pre-K until 8th grade. And then for high school, I went to Regis Jesuit High School. And honestly, high school was a really formative experience for me. I love the Jesuits in terms of their philosophy of combining faith and social justice. I think that high school really lit a fire in me to do more work in the social justice realm. It's where my junior year of high school, that's when I became passionate about Black maternal mortality and was like, oh my goodness, what can I do to address this? What is being done to address this? And I would say in 2nd grade is when I was wanting to be an OBGYN because pregnancy is so cool.
I was about to say scary. That's my first word.
No, I think pregnancy is real cool. just the fascination of it, like a human is growing inside another human and like relying on them for nutrients and like the bump and all of that. So I just love pregnancy. And that's when I was like, I'm gonna be an OBGYN. I was like, I really only wanted to deliver babies. And then I found out what like OBGYNs also have to do. And I was like, oh, that's not. So that's when, so I like hesitate telling people this, but I'll tell you. I watch Grey's Anatomy. I'm a big Grey's Anatomy fanatic.
There's nothing to be ashamed of.
No,
for
but listen
watching
to
Grey's.
this. The reason that I became passionate in maternal fetal medicine is actually because of Arizona Robbins, fictional character who starts like becomes a maternal fetal medicine specialist, and like it becomes very clear to me that that's a path that you can take that will guarantee that you will really only focus in pregnancy. Maternal fetal medicine specialists really focus mostly in high risk pregnancies. So I'm talking like multiples. If you have gestational diabetes, you would often be referred to a maternal fetal medicine specialist. If you have an autoimmune disease, like there's a variety of reasons that you would be referred to a maternal fetal medicine specialist during your pregnancy. So I was like, yeah, that's what I want to do. Like, I want to do that. I only want to be focused on pregnancy. I want to do these cool surgeries and stuff like that. And then I got to college. And I started college at Creighton University.
Yeah.
Not too much.
Not
Not too much. It's funny because I genuinely do think I believe a lot in like universal science. And I genuinely think that there's a very concrete reason why I went to Creighton. And I think it's a lesson that I've taken in my journey as I've continued on. I think the biggest thing being be open to what life has for you. Like, I think especially like being so young and being like, oh my gosh, okay, this is what I want to like do. I want to be a maternal fetal medicine specialist, like all of these things. It was like, okay, so I have to do this, I have to do that, I have to do this. So it was like, I felt like my life was a prescription pad and I had to literally follow that pad to a T. And it's became known that that's not really how life works, because when I got to Creighton, it was, yeah, I mean, very, and when I got to Creighton, it was the pandemic. So then already I was like, dang, how did we get here? Like, we're masking. At first, I was kind of like,
wait, you said we masking. Was that a double entendre?
I don't know what that means.
Double entendre means it has like two different meanings. Were you like, we masking, but we masking?
I don't know. I don't think so. I mean, maybe. I mean, it's funny because I do think that when I got to Creighton, I was young. I mean, duh. I was what,
a freshman,
18 when I started. I think I still had a lot to learn. I mean, at first it was like I was part of a living learning community. And it was like we had to go to these required meetings and I was building community, but I also at the same time didn't really feel like I belonged. And it wasn't the first time in my life that I felt like that, but it was very notable because especially, you're in college, you've dreamed of being in college your whole life and you thought it was going to be this grand old thing. You were going to make a bunch of friends and things like that. And that's not what really happened for me. And I think a lot of it, to me, it kind of brought back like a feeling of, and it's a feeling I've felt my whole life, being raised by Ivorian parents, being in America, that dichotomy of being African, being American, and to me, being African American, because like, not in the traditional sense, obviously, I don't have descendants that were slaves that I know of. But I consider myself to be African American. I consider myself to be a Black woman. I have a lot of different struggles that I've gone through in finding my identity, finding myself. And in that moment, it genuinely, at Creighton, I was like, wow, I'm not really finding my place here. I feel like I'm not very understood. And COVID did not help things. I actually ended up spending my second semester at home.
Because why are we paying room and board?
Okay, yeah, no, and that's literally what it came to. It was like, I mean, I saved my parents a lot of money. Let's say that too. And I basically, I don't know, you were still in high school, but basically, second semester my freshman year, COVID had surged a little bit post the holidays.
Mm-hmm.
So my school didn't do, a lot of colleges across the country pushed back their date to return, or they were remote for the first 2 weeks.
Mm-hmm.
And Creighton didn't do that. Creighton was like, okay, yeah, like just come back.
That is weird.
Yeah. So I was like, dang, I don't want to go back. Like, I'm not trying to get COVID. And at that point, I had not gotten COVID yet. Actually, to my knowledge, I have never had COVID, actually.
Same.
Yeah. So but I think it's one of those things where now, because it's become more flu-like, like I feel like I've probably had it. I just didn't test and I didn't know. But yeah, so I told the college, I was like, hey, like, I don't feel comfortable coming back. Is it possible for me to stay at home for some of the semester and then come later on? They were like, no, either you come the whole semester or you stay home the whole semester. And I was like, okay, I got y'all. Staying home the whole semester. And funny enough, that was probably, arguably, it was one of, I mean, I've had great semesters here at Pitt, but that was genuinely, I had a grand old time at home. I mean, at the time, my friends at the time were still seniors in high school, at my high school that I went to. So we were living it up. I would be in class. We'd be on FaceTime during class. My dad, one day, because he was working from home, one day he was like, do you actually go to class? I was like, yeah. Like, I'm in class, yeah. And he's like, I hear you on FaceTime, right? I'm like, yeah, but I'm in class too. Yeah. So yeah, we would be on FaceTime. I mean, I didn't go to prom with them, but we did like dinner before prom, and then we did like, we had like an after prom and things like that. So
y'all lucky y'all had a prom. I didn't have a prom.
Really?
Nope.
I'm so sorry.
I got both of the years taken away.
Dang, I'm so sorry for your loss. I think part of it is that Regis is a smaller school. They still had to wear masks and things like that, but yeah, they had a prom. Regis, honestly, and it's funny I say this, but I was telling folks, sometimes I feel like I didn't really get closure from Regis because I didn't have like that last day in the hallways, like they did a bunch of cute things for us, like they did a parade and things like that. But sometimes I still feel like a little bit of non-closure, interestingly enough. But yeah, so that was one of the best semesters of my life, though. We had a grand old time. And I was like, I'm gonna give Creighton another chance. I was like, I can, like, maybe it will be better. COVID will be da da da. And then my parents were like, so maybe you want to find a less expensive option. Like, maybe let's not do this whole trial and error, because this is a very expensive trial and error. So I was like, okay, no worries. So my options were CU Boulder and any other school. I wanted to keep my major that I had at Creighton. That was a big reason I was drawn to Creighton, is not only because of the Jesuit tie, but because of the major I was pursuing. I was pursuing emergency medical services. When I would have left Creighton, I would have left as an EMT. So I wanted a similar program. And I looked, and I finally came across Pitt's program. Pitt's program is different, the emergency medicine program. It's different in the sense that you come in as an EMT and you end as a paramedic. So it's a little bit more rigorous and more intense, but I was like, oh, I want to do it. So I applied to Pitt. I came and visited because my mom was like, I don't want to hear nothing about, oh, I don't like it. It's not what I thought it was going to be. Nah, she said, we're not going to do that again. So we're going to come visit and we're going to make sure that you like it here. I came here and I was like, wait, this place is kind of cool. I do think there might have been a little bit of a placebo effect in the sense that
it's not Creighton.
No, in the sense that I wanted to not be in Denver so bad that I was willing to make anything else work. Now, I do genuinely love Pittsburgh, but at the time it was still like, oh, like this is a new place, like I don't really have friends here. I'm really far away from home. Like it was all of those things, but I was like, oh, I'm gonna make it work. Like it's gonna be fine. It's gonna work out eventually. So came to Pitt, and when I got here, I was pre-med. still, because again, like I've mentioned, maternal fetal medicine specialist, like that's what I want to do. And I was still pre-med and, stayed pre-med. I was a sophomore when I came to Pitt. When I left, or when I dropped being pre-med, I was a second semester junior.
Mm.
This was after I took OChem. OChem is
I'm
OChem.
glad I never had to take OChem.
I'm happy for you, because genuinely, I am very, shout out to Dr. Bandick, because he is that man. He is the reason, the grade that I got in OChem, he is the reason I got that grade. Because it really just was not clicking in my head. Like I was doing everything I could. And I think it was that point, and I mentioned the emergency medicine. Going back to that, what happened was, when I started talking to them, they basically told me that the program is very rigorous, and I wouldn't graduate on time if I tried to do the program and be pre-med at the same time. So I was like, dang, I need to graduate on time, because again, these are very expensive um, programs. School is expensive. My parents are not going to pay for an extra year just because I want to have this major. So that's when I started looking, because I knew I didn't want to major in like biology, chemistry, psychology. Like I didn't want to do none of that, because honestly, that stuff doesn't really interest me that much. Like not enough to like be like, oh my gosh, like I want to have a bachelor's in biology.
You weren't moved.
Yeah. So I kept looking, and I forget exactly how this happened, but I'm pretty sure someone told me to look in the College of General Studies, and that's when I found the health services major. And I was like, ooh, this is very interesting. Then I looked into the managing programs and projects track. I was like, wait a minute, this is it. So that's what I ended up changing my major to. Declared that major sophomore year, second semester. So that was my major, and then I was still pre-med at the time. So the funny thing about that major, and then also I also then that's when I became part of the pre-health scholars program here at Pitt. And that program was really such a important part of my story here at Pitt, because having an advisor, having the programming that they had, and having a mentor really opened my eyes to different facets and different perspectives I could take on to address Black maternal mortality. And I really started to grapple with the fact that maybe I didn't need to become a doctor to do what I wanted to do. And that's literally what happened. After junior year, I'm taking the OChem class. I'm miserable.
Yeah, it's
I'm
OChem.
literally miserable, because I am not understanding, and this is also after taking Gen Chem, and Gen Chem didn't go well either, but I was determined to make OChem go well, and it wasn't going well. So I'm miserable at this point. I'm just like, oh, this is not going well. Like I don't know if this is what I want to do for real. And I started to really, and I think to anybody listening, this is really like something you should like think about and sit with, is doing stuff because you want to do it and not because you think you have to do it. Because that's really what it came down to, is like I felt like I had to go to medical school. I felt like I had to do these things to do what I wanted to do. Everybody's counting on me, all of those things, when in reality there was a different path that I could take to help me accomplish the same, if not similar goals.
So about that path,
Yeah.
for anybody who's listening who doesn't know much about the health services major, what's the lowdown?
Okay, so that major is CGS, and honestly, I'm gonna be super real right now. CGS, I really do think at Pitt is the forgotten school. I think that we often get forgotten, especially those of us who are traditional undergraduate students in CGS. Um, I think that we often get looped under Dietrich, but then we don't get looped up enough, because we're also like, for commencement, for example, CGS doesn't have a ceremony. And you would think, oh, like maybe they'll be a part of Dietrich's ceremony.
They're not.
No, even though we wear the same color as Dietrich.
So then what's going on?
I don't know, and that's what I'm saying is that I think that it's hard to like feel a sense of belonging in a sense when you're often kind of left to the side because you are a non-traditional. Like the idea for CGS is it's meant to cater to non-traditional students.
Mm-hmm.
A lot of well, and I mean I was talking with someone and they were telling me that actually it might not be true that there's that many non-traditional students in there. And I mean, even in my experience, all the classes I've taken, I feel like it definitely does feel more heavy in undergraduate traditional than non-traditional student. But the idea is it's meant to cater to non-traditional students, CGS. So a lot of the classes are offered online. A lot of them are offered asynchronous. A lot of night classes. But the major, by far, I've really enjoyed the courses I've had to take for it. Had to take intro to epidemiology. Shout out to Dr. Songer. Love him. Took health law and ethics. Shout out to Dr. McCarthy. Dr. McCarthy, and I would be super remiss if I didn't talk about Dr. McCarthy because Dr. McCarthy was one of the first professors I had here at Pitt. I had her my first semester here at Pitt. And I'm new, I'm trying to figure it out. I'm a little nervous. It's like, and Dr. McCarthy had office hours. I would always go to her office hours. And she really just like was always super willing to have conversation and put me on the right track, was always willing to like tell me about opportunities that I might be interested in. We had some of the best conversations about ethics, bioethics, thinking about it in the lens of like what I'm interested in, maternal mortality, thinking about it in other lenses as well. And Dr. McCarthy, throughout my time here at Pitt, has always been a resource and been a mentor for me. And like, yeah, shout out to her because I genuinely don't her. So it would be Dr. McCarthy and then also Dr. O'Reilly. Dr. O'Reilly was my bio professor. I was coming in and I was nervous because I had to withdraw from biology when I was taking it at home because as we mentioned earlier, I wasn't taking it that seriously. I'm not gonna lie, I wasn't taking it that seriously, but I was still kind of nervous because I was like, dang, I don't have to withdraw from this class. And Dr. O'Reilly really just was like, Mary, like you're gonna pass, like you're gonna be fine. I went to her office hours religiously as well. And again, she has consistently remained a mentor and a resource to me. I served as her TA last semester. And her willingness to really want students to learn and want to meet students where they're at is remarkable. And her flexibility is remarkable. Her ability to create meaningful learning opportunities is something that really stuck with me in terms of, and also her desire to want to include students in their journey. And I think, I don't know if there's one thing that I've learned throughout being an undergrad, it's college is what you make it. Like genuinely, college is what you make it. Like if you want college to like not go well,
it can be saying, like it can be a self-fulfilling prophecy.
No, literally, yeah. So I mean, and I genuinely think that I took advantage of all of the resources that I had available to me because one thing about it was I was not going to fail. And Dr. Riley, Dr. McCarthy, those two professors will forever be people that I will name by name as people that were instrumental in my journey here at Pitt from the beginning. So health services, so health law and ethics was a class that I took. What other classes? Had to take introduction to management. I took global health pharmaceuticals. And I feel bad because I'm forgetting. Oh, Dr. Wanderer. I'm pretty sure that's the professor's name, but that class was also really interesting because I had never thought about pharmaceuticals and like the globalization, how globalization and pharmaceuticals come together, big pharma, like all of those things. And I was just like, oh my goodness, this is intense. That was good. I also took grant writing for nonprofits. So the idea is there's 5 courses that you have to take. I've listed some of them and I'm forgetting some of them, but it's intro to epidemiology for sure. You have to take health law and ethics. The other one you have to take, I believe, is health communication, and then contemporary issues of medicine and healthcare, something like that.
I was gonna say, if you don't know, you're not the academic
Yeah,
advisor.
no, exactly. But a lot of those classes were very interesting. And then you get to choose a couple of electives. I think it comes down to like 5 electives. So there's like a whole, like the list is very, it goes from everything. Some of my favorites that I've taken: global pharmaceuticals, writing for nonprofits, um, what else? African American health issues, like that as well. Shout out to Dr. Fapahunda. And yeah, those are some of the ones that are just kind of grasping at me right now. But that class or that major, and again, the mentorship and the guidance I was getting from the pre health scholars program really made me think more about public health. I didn't mention, but public health has low key always underscored my life, because my mom is trained as an epidemiologist. She currently is an infection control preventionist, and she also is an RN. So she in high school, and I'm gonna be real, she made me do this. She was working at the State Department, the Colorado State Department of Public Health, and Environment at the time, and they were doing this new program. It was it's called Youth Partnership for Health. And someone had told her about it, and she was like, "Oh my goodness, Mary, you have to do this." And at first, I was kind of like, "Oh, like I don't want to do it. Like no, mommy, please don't make me." But like, I did it, and again, very formative experience in my life. It really, basically, the idea of the program is, um, it's a way for youth across Colorado to give input on policies and programs that relate to them. So we did everything from like smoking cessation programs. We did some infant safety things. We also did some maternal mortality things. We did all of the things basically, and we would come in. They would present their presentation or their program or whatever they had, and we would sit there and we would give them feedback and how they can make it more marketable and appealable to youth. So that was really like formative in terms of like giving me knowledge of public health, all the while my mom, having me go to conferences with her. She was also involved with the Colorado Black Health Collaborative at the time. Um, Again, my mom, as much as, and shout out to my mom, as much as like, you complain about things in the moment, I genuinely would not be where I'm at without the experiences that my mom um helped encourage me to do.
She was cooking with getting you in those extracurriculars.
I mean, yeah, and it's like not a lot of people have had that exposure to public health before even getting to college.
I was
Uh,
gonna say, I think for people in high school, I think that honestly, the biggest thing that you can do is to shadow, because that's how you can actually know if you want to do something.
And that's one thing I will say I didn't do in high school.
Mm.
I would say like it's funny if you were to look at my co-curriculars in high school, you would be like, "Huh, so she's interested in public health, right?" Because I didn't do any of your shadowing things, like a lot of those programs that people like the pre-med people do before they get to college. I didn't do none of those. Like I really just did stuff in public health, because it's honestly the stuff that I found the most interesting, and it was the stuff that was like readily available to me. Like I never really had the time to explore the pre-med side of things.
Mhm.
But yeah, the pre-health scholars program again really helped to show me how I could tackle what I wanted to tackle from a public health perspective, from a health administration perspective. That's what my major was bringing. So pre-health scholars was bringing, "Oh, Mary, you can tackle this from a public health perspective." My major was given, "You can tackle this from a health administration perspective." And that's when I would say over the summer, especially after taking OChem, I was like, "Okay, I'm dropping pre-med. I'm not pre-med anymore. We're
Mhm.
not doing that anymore." And easily the best decision of my life. My advisor, shout out to my advisor, Shannon DeMatteo. She is that girl. I feel like I've shouted out so many people, but really,
good on you. Spread the love.
No, yeah, and because honestly, and for those out there listening, really think about those people in your college career who have been instrumental to your journey, and make sure you let them know how much gratitude you have from them.
Give them their flowers.
Because I think sometimes it's easy for people to not feel like, not that people do things for like the recognition and things like that, but I do think as humans, it does make us feel good when we know that we are impacting people's lives. And that's how I feel. Shannon DeMatteo, she really guided me. She was the one that helped when I did my whole major shift and things like that. She was the advisor I was assigned in CGS. She gave me a lot of good tips and guidance in terms of like the classes I was taking and things like that. And I remember her telling me, I think when we met in the fall, she was like, Mary, you feel a lot lighter. Like you feel lighter, and I'm glad that you made this decision for you, because it's a hard decision to make, especially when you've spent most of your life feeling like you were going to be a doctor and thinking you were going to be a doctor and doing the things to be a doctor. So yeah, it was I won't say it was an easy decision to come to. Definitely had my parents in one ear, like, like, Mary, you need to make money, and immigrant thing where it's like, okay, we want you to be a doctor, we want you to be a lawyer, all of these things. And I've had to do a lot of work and kind of, not, I won't say retraining, but telling my parents and showing them how you can make a career outside of being a doctor, outside of doing those things. And that's what I've spent a lot of my time doing. But it really became clear that I wanted to combine my passion for public health and health administration and figure out how I can use those two things to tackle and address Black maternal mortality. So yeah, that's kind of I would say the biggest rundown. This past summer, I participated in the CDC John R. Lewis Public Health Undergraduate Scholars Program.
Shout out Ashanti.
Yes, Ashanti, that's my girl. So I participated in that program. That program was also very formative. Learned a lot. It helped really expose me more to public health, especially not technically being a public health major. I definitely needed that exposure and that experience. I was working at the Community Engagement Center, partnered with the Community Empowerment Association, learned a lot about Homewood, thinking about social determinants of health and health disparities and how we address that. And yeah, that was a really great experience. I met a lot of wonderful people from across the country. And I think the biggest thing up until that moment, up until I got into that program, I think I get distracted. A lot of my high school, Mary, come on. A lot of my college experience has felt like, oh my gosh, am I doing the right thing? Like I'm not doing research, or I'm not doing this, I'm not doing that. It's funny that you say I do so much, because I sometimes feel like I don't do enough.
Comparison is the thief of joy.
I really say that again.
Comparison is the thief of joy. You got to run your own race.
It really is. And I think up until that program, I really was like feeling like I hadn't done enough and things like that. And it's like when you get into a program like that, such a competitive program, and people see your value in your market, you're like, dang, like I have done enough. Like I've done what is enough for me. And what other people have done does not, again, comparing what other people have done to what I've done is detrimental, and my journey is my journey, and it's happened the way it's happened for a reason. And I'm forever grateful for it's funny because I feel like, especially since I'm graduating soon, I'm getting a little teary-eyed, but especially since I'm graduating soon, I've definitely had a lot of moments recently of really immense gratitude.
I was gonna say, this is already the Gratitude World Tour. You're gonna shout out you, shout out you, shout out you.
No, because I'm telling you, Ian, and really, like, I genuinely, you can't go through, what I always say is you can't go through this life alone. And I genuinely would not have made it through Pitt without the people that have helped me along the way and the people I've met, the people who have guided me. Um, Shout out also to Dr. McCarthy's husband, Provost McCarthy. Um, I am so grateful that he is the provost because his dedication to students and improving the student experience at Pitt is very tangible and remarkable. I see him at, we always, whenever we see each other, we make the joke like, oh, seeing you again? Because we see each other a lot because, and I think again, that shows his commitment and dedication to improving the student experience and being a part of the student experience because he is a very visible part of this university.
Mm.
And I would be remiss if, like, in all of this, my second semester junior year, um, I like said this wrong. I took OChem in the fall and I think I dropped it. I took OChem in the fall and then in the spring I wasn't pre-med anymore
Mm-hmm.
because then that's when I found I my best friend was working with Ron as his grad assistant, and in October I used to work at Starbucks, y'all. So
this a glow up right here.
You know what I mean? But no, not too much on Starbucks. Just kidding. No, not too much on Starbucks because boycott Starbucks. But anyways, I was working at Starbucks at the time, and they were not scheduling me. Like, it was getting really annoying because I was having to dig into my savings, and like it just wasn't working. And so my friend Monica, she was like, "Oh, like, well, Ron, like I used to work for him. He is looking for student workers." So I met with Ron in October about, like, talking. He was like, "Oh yeah, like, Mary, this sounds great. This sounds great." And then October came and left. November, December, January. Ron reaches out to me again and is like, "Mary, let's schedule a meeting. Like, the positions are finally posted. Sorry it took so long. Like, we had to go through all these things." And I go to meet with Ron, and I'm not gonna I'm not gonna put on record the reason that I applied to the honors college, but I did apply to the honors college position and not the Center on Race and Social Problems position because, as y'all know, if you've been tuning in, then you know Ron has a dual position, CRISP and FHC. So I applied to the honors college position, and when I tell you, and I've it's funny, I've said this. I know I've said it's funny, but there's a lot of things that are funny. I've said this to multiple people throughout these past couple days. Ron Idoko is really that man. Like,
we have heard this so many times this season.
But seriously, it's really a testament to his character and who he is as a person. And I am eternally grateful to be in community with him and be under his leadership. If a lot of, I don't think I don't know, he probably talked about this, but kind of Ron's philosophy is that if you give student workers the tools and the knowledge and the resources to do the work and you position them to do the work, they can do the work. And that's really what Ron did for me. I feel like when we first started in social innovation, it was me and Ron. Before we brought on Ian, before we brought on Ani, before we brought on Connor, shout out to them too. It was me and Ron. And Ron really positioned me to drive a lot of programming. I mean, literally my first couple weeks into the job, I was putting together Changemakers in Conversation with John Carlos. So I was doing the things basically. And I'm thankful that Ron put so much trust into me. And I'm thankful that he also created a space where my ideas were meaningful and like no idea was ever really a bad idea.
I was gonna say, whatever trust you were given, you've taken it and ran with it. You've done so much.
I mean, but again, like I would be remiss if I didn't acknowledge the fact that like anything I've done, it's because I've had Ron being like, "Mary, you got this," like, helping me with things and connecting me to the right people, being in certain conversations, giving me certain ideas. Like, when I first started in FHC Social Innovation, it was me and Ron. So like a lot of these things is like we kind of came up in tandem with each other. I was telling the story yesterday. When I first was working with Ron, we were sitting on the 20th floor. and Ron's office is here. There was like a middle office. And Ron's wife always tells this story, but one day she was in his office, and I didn't know this, but Ron and I did this thing where we would be sitting at our respective desks and we would just be talking through the wall. So she's like sitting in his office and we're like talking through the wall, and she's like, these two are a good duo. And yeah, I really do think we are. And again, immensely grateful for Ron. I am super encouraged and like empowered by his passion to change the world and his creativity, his vision, his not a lot of people see the good in everybody, and Ron definitely sees the good in everybody, and I think that's important. Seeing the good in everybody, I think that Ron. But when I first started, I couldn't really tell you about social innovation, but now I'm like, yeah, social innovation. You have to start with social inclusion, and that's when you have people from diverse mindsets and diverse backgrounds, that's when you can truly be socially innovative. And through social innovation, we can accomplish social change. You know what it is. So, yeah. And so I'm grateful for Ron. I would be, again, remiss if I didn't shout out the people in FHC who have also been very remarkable in my journey. Shout out to David C. Frederick himself.
The man.
Because a part of the reason I was able to stay at Pitt is because I got the David C. Frederick Scholarship. So that really allowed me to stay at Pitt. And I am immensely grateful to receive that scholarship because it also allowed me to make the shift from working 30 hours at Starbucks to, again, yeah, they weren't scheduling me, but also then helped to allow me to be more involved in my extracurriculars and things like that. So that scholarship really was a pivotal moment in my journey. And Lauren, Diane, Dean Foote, Assistant Dean Hornyak, like all of these people, Gail Wolf, Liz Adams, Jay Russ, like all of these people in FHC, Terry, Kate, like all of these people are a big reason, and if not the only reasons that I'm able to do what I do, because they have been very instrumental in supporting the journey. Being like, oh yeah, maybe that's a great idea. Terry and Kate will help with the OCC. Terry will help with the social media. So it's like, yes, when you see it, it's like, oh, Mary is doing it. But I have so many people in my corner. Can't forget Ani, who at the very beginning, back when it was me and Ron, and then we added on Ani. So then Ani came in and she was helping me send emails, creating graphics, all of these things. So it's like, yes, I have driven a lot of things, but it wouldn't have been possible without the people in my corner helping drive it. So yeah. And hot off the press. Ian, I'm gonna tell you later if you can keep this or not, but it is because of that and because of the people in FHC, because of the feeling and the ability to drive programming and having my wildest dreams. Like there are so many things like change makers in healthcare that I just did recently. Like that really it was an idea, and then all of a sudden it became something, and it was something, and it was amazing. And I got the year of discourse and dialogue for it. So like all of these things, a lot of momentum that I've built, and it's just like now I don't want to leave. So hot off the press, I'm not leaving. It's obviously still in the works, so that's why I'm like, maybe you won't keep this, but yes, it's because of that, because of the relationships, connections, and the momentum that I currently have. It's where I feel like my journey at Pitt is not over. And there are so many things. I don't want to say a legacy, but low-key a legacy.
I was going to say it earlier that you're building a legacy.
You think so?
No, for sure. Your legacy is the Office of Social Innovation. You pushed so much for it. I'm not trying to make you cry.
It's funny because, again, Ian, I should say I am grateful for you, Ian, because when we had this podcast idea, I remember I was like, this is a great idea, but I don't really have the time to like really drive it as much as I want to.
Mhm.
And you have literally, quite literally, taken it and ran with it. Like what? We on the last episode of season 2.
We 25 deep.
Like, this is crazy. Like, you've really done the thing. You've brought on so many cool, different people, highlighted programs in Pittsburgh, all of those things. And I'm just like, people like you, y'all are what make it worth it. Y'all are what makes me want to wake up every morning and do this again. When I think about my students in the Social Change Research Hub, the work they've done with the Racial Equity Awareness Database, I'm just like, this is a shout out to Meg, and the rest of y'all. But like, this is the stuff that we're doing. Like, look at the tangible things that we're doing. Look at the ways that we're making risks in the community. And I don't know, it really makes it all worth it. And I'm like, I don't want to leave for now. I want to definitely, there's a lot, y'all know my mind, or y'all don't know, but you know my mind. I have a lot of things spinning. There's a lot of things I'm working on. Oh, shout out also to the Changemakers Media Lab, Paige, Andrew, Aditi. Y'all are real ones. We're working on a real cool project right now, and I'm really excited. It's almost done. By the time y'all are watching this, it's almost done, if not done. So yeah, it's been amazing. I feel like there's been so many cool things that I've gotten to do. I mean, we went to Baton Rouge.
We did.
That was amazing.
I gained 10 pounds. It was worth it.
No, but that was amazing. And that's what I'm saying is that, like, Ron is really intentional about making sure we have access to formative opportunities. And it's not even just about, like, it is like Ron too, but it's also literally speaks to honors education. Because to me, the beauty of the honors college is the fact that no two people, I mean, take this lightly, but like no two people have the same major. It's such a mix of different majors. And when you put that all in the same room, it's crazy the things that can happen. I mean, you literally health services engineering major, what you get? Podcasts. Exactly. So it's literally that type of stuff and that type of drive that I think makes honors so different. And I think positions honors students to go out into the world and be beast, like be different, think about things from a different perspective, because that's the thing about social change is like it's not a prescription. You need a multi-discipline, multifaceted approach to accomplish social change. You can't just come at it from one angle. You got to think about it from a bunch of different angles, because coming at it from the same angle is part of the reason we're at where we're still at. You know what I mean? It's like, we need to be creative. We need to think about creative solutions. We need to think about how do we engage people differently? How do we inspire people to want to make change? And that's, I mean, again, I do think that a lot of, even when I think about like what my end goal is, a lot of that is built on the foundation of social innovation, built on the foundation of having an honors education, built on the foundation of being at Pitt. And I'm immensely grateful. I'm excited to see where I go from here. I'm excited to see where the podcast goes. I mean, Ian, again, you've just had so many wonderful people on here. I hear so many people tell me about your ability to really create a story, get the story out of them, tell the story that needs to be told, that they haven't had the opportunity to tell. And I think that's really important. And I think, I don't know, it's like, I feel like it's weird because, you know, you ever have those moments where you're like, oh, this clip right here, this is the clip I want to play when I like win like an Emmy or something like that. You know what I mean? Like, you ever have that moment where you're like, yeah.
Oh yeah.
Yeah. Like, can we run this back? Can we freeze this moment right here? Because I mean, I don't know. I have so many moments like when I think about just like all that we've done this year, I think back to those moments. What? Literally did 5 programs in 1 week. Unheard of. I actually don't even know how we did that. I'm pretty sure that's actually why I got sick, but like neither here nor there. But genuinely, like I've met so many incredible people. Shout out to the experts in residence Sherry, Morgan, Damon. It has been my immense pleasure to work with them. They are all so different, but they bring so much knowledge, so much life experience, and they have truly imparted so much on me. And Morgan has brought some of the most incredible people to talk and be in conversation with. I mean, the conversation with Taylor, just Siri, most recently Sydney Etheridge, like those were amazing conversations. They've all been amazing conversations. And Sherry, I mean, a couple weeks ago we did her event, and it was great seeing the students like interact and really want to learn about international careers and the passion that the panelist she brought had. And that was great. And then Damon is so funny, like super funny. He recently had his How to Write About Place event, and that event was super funny. We did it hybrid, and there was just like some moments where someone online was like saying something and it was popping up on the big screen, and it was really funny because it was funny how like that person, like how he was able to still include the people who were hybrid into the in-person experience we were having. Talking about August Wilson and his journey as a writer and how he incorporated being from Pittsburgh into his writing. So again, they are all remarkable people, and it's been my utmost pleasure to work with all of them. And it's just been like when I look back on this year, it's like, dang, I can't believe we did all of that. Like now I don't have any programs left for the rest of the semester, and I'm like, now you really get a chance to like look back and be like, wait a second. I was talking to Spirit yesterday. Spirit, remember you had him on your episodes?
Yeah, of course.
Yeah. So I was like, yeah, Spirit, like he was giving me his book, and I was just thinking, like, because that was one of the first events we did this term. So I'm just like, it feels very full circle.
Yeah.
I don't know if there's anything I'll say about my collegiate experience, and for those of y'all out there listening, if you sometimes are wondering, like, dang, is it working out? Know that it will work out eventually. Take a deep breath. It will work out eventually. I genuinely think that a lot of my experience in college has been very full circle. Full circle. I mean, who would have thought I would have got the David C. Frederick Scholarship? At the time, that scholarship, you didn't have to be an honors student. But now I'm ending as an honors student. I'm the commencement speaker. Like, wait. You know what I mean? Like, it's just like those type of things and experiences and opportunities.
Just so you can never see coming.
When I look back, like when I think back to like senior year me didn't even know about the University of Pittsburgh. No offense. But like seriously, especially being from Colorado, you know what I mean? Like I'm Pittsburgh. Like I didn't know about Pittsburgh. So senior year me never could have imagined that I would be senior year now. You know what I mean? So I don't know. Grateful to my parents for funding this education. My family, my friends, because also I should know, like, my friends have also been very formative in my experience, my life journey. I mean, again, remember, like, your friends. I think a lot of times we don't really think about like how our friends impact our life. When I think about like my friend who literally is the reason that I work for Ron, I'm just like, what would my life be?
That butterfly effect is crazy.
What would my life be without that? You know what I mean? And without that friendship and learning so much about yourself through friendship, being in community with others. And that's like, if there's one thing that I hope everybody who's listening takes away is that, again, we're not in this life alone. We are in community with others, and bask in what you learned from others, bask in what others give to you. Give people their flowers, let flowers be given to you. And I really do think that with that in mind, that's that sense of community and that sense of like wanting to work together is really how we can tackle some of the most pressing social issues. I really think
So
so. Yeah.
you've already dropped so many different nuggets of
I
wisdom,
try.
life advice, life lessons. I'm not even gonna. We've been fed. We have been fed. I'm actually going to
Stop.
change the format of this episode, just the way that's been flowing. I
Yeah.
think that it would be a disservice to Funky Lamp or Artist Spotlight if we were just going to throw them in here now at the 55-minute mark. So I think that it would be best just to have them as an outro. So I think that now would be a good time to transition to our topic of maternal health care.
Okay. Yeah. I mean, I've definitely I think throughout I've talked a little bit about like Black maternal mortality, maternal health care, and it's funny, not funny actually. It's serious. The issue of Black maternal mortality, I mean, in Pittsburgh, it's actually worse than a lot of comparable cities. I think I was actually just looking at these stats the other day. I think Black maternal mortality is worse than 96% of comparable cities in Pittsburgh. Like, so it's worse in Pittsburgh than 96% of comparable cities.
That's crazy.
And if I'm wrong on that stat, look it up. But Black maternal mortality, my senior year in high school, I read the story of Kira Johnson. I think I first came across a story in Apple News of Tracy Cottom. And Tracy, she basically was experiencing issues with her pregnancy. And she called the doctor, she went into the doctor's office, and they weren't helping her. And she ended up bleeding through the chair, like the waiting room chair. And she describes how the nurse was almost more concerned about the chair than she was concerned about Tracy. I guess they like did their exam and they looked and it was like they were like, "Oh, you're fine, like go home." Um and she ended up coming back again and she lost the baby. And I think like the most notable thing is the nurse asked her like, "Oh, like why didn't you say anything earlier?" And it was like, "Well, I did. Like y'all just didn't listen to me." And now look where we're at. And then Kira Johnson, her story is one I will never forget. I remember reading it in a people.com article, but the way it was written was just so heart-wrenching. Because the biggest thing that the misconception that often happens with like Black maternal mortality is like, oh, these these women aren't going to their prenatal visits. They're not taking care of themselves. Oh, they have this, that. Kira Johnson came from a wealthy background. She was giving birth at Cedar Sinai. That's the hospital that Kim Kardashian has her babies at. So, like, that's not an excuse here. And she went in, she had the baby via C-section. She had a healthy pregnancy. She was fine. And her husband, Charles Johnson, noticed that her catheter had turned pink. And at that moment, um, he alerted the nurse, and the nurse was like, "Okay, we're gonna order a CT scan, and we'll do other tests." The other tests came back, and they like were kind of abnormal, and they were like, "Okay, like we're gonna get you in for the CT scan." That CT scan, and I know I just said I would never forget the story, but like now some of the details, I'm like, wait, am I saying this right? But from my recollection, that CT scan never happened. Basically this all started happening around like 2 o'clock, 1 o'clock, and it was not until after midnight that they brought her into surgery. And when they opened her abdomen, like half of her blood volume was in her abdomen.
That's crazy.
She had lost tons of blood, and she went into cardiac arrest and they were unable to revive her. And so she left behind the son that she had just given birth to and this another son that she had had previously. Um and you know, that story to me is hard because that time lapse, that time period where it was like there was so much, had that window been a little bit shorter, she probably would have lost a lot less blood. And like it's like for me, the issue that I had when I first learned about Black maternal mortality, it's like the what ifs, like what if they had this and what if that, what if that. So then that was also at the time when Serena Williams had her pregnancy or her labor scare. Beyonce had her moment. So it's like these are Serena Williams, Beyonce. These are people of remarkable. These are celebrities going through these same issues of not being believed. Like, what's the true issue here? Um, and I just was like, what's going on here? The Black maternal mortality rate, according to the CDC, is 3 times higher than women of like white counterparts than their white counterparts. Um, and to me, that's unacceptable. I mean, maternal mortality just overall in the U.S. is absorbently or absorb. What's the word?
I can't say it
Yeah,
either, but you
but
know
y'all
what we're
know
trying to
yeah.
say.
So like, it's high. It's
Mhm.
extremely high here in the United States, and it to me, it's
We rank in the same vicinity as developing countries.
and that doesn't make sense to me. Like, it really does not make sense to me. And then when you put on top of it the Black maternal mortality rate, it's like this is a very serious and intense problem, and it's like I want to do everything I can to change it. And in Pittsburgh, they are doing so much. I mean, I also became a part of the Maternal Child Health Equity Scholars, and that's when I learned about the work that like Dr. Darren Mendez is doing. And there are so many other people who are doing work here in Pittsburgh to try to address it and figure out how we can change the landscape. And I want to be a part of that work. What that looks
I was
like,
going to say, my burning question is from a health services perspective, how can we prevent these tragedies?
I mean, I don't know. So a lot of like when I first started learning about it, and I think there's still so much I have to learn and think about. But one perspective that I feel like I want to come about it from is like an administrative like, perspective, like where it's like you are creating protocols and trainings for your physicians that encourages them to see the whole picture and to center their patient and their patient's needs at the center of their care.
Mm-hmm.
I've recently been working with the Midwife Center, and the midwifery approach um, to labor and to maternal care is a lot different in the sense that their philosophy is literally patient centric. And they have the stats to show that their outcomes are a lot better than others, you know what I mean, because of that different approach that they take. Um, and I think that's I don't know, to me, that's what I think is part of it, is like we have to look at things from a different angle. We have to come at it from a different angle. Um, I do think that a lot of I mean, working with Ron, Racial Equity Consciousness Institute, I do think that a lot of these issues or these like something like maternal mortality, I do think that education and consciousness is needed. Um because I mean, I've done some preliminary like when I've done my literature reviews and things like that, it's like a lot of what they'll talk about is like implicit bias. So there might be a lot of that in there, and just like the stereotypes that have been passed down of I mean, you have the stereotype of Black women don't experience pain the same way that white women do, like all of those things. So how do we change that mindset and instill in people to think about it differently and be like, no, like we all experience pain the same way. And the whole like I it's I don't know if I really want to be on the record saying this, but like I struggle with the whole Black women are strong thing.
Mm.
Because yes, we're strong, but
It doesn't mean that we need less care.
exactly. And that's the issue that I have with that. Like, yes, I consider myself to be a strong Black woman, but I still feel like I deserve the same amount of care, the same level of care, and the same level of respect. Because I've also, in some of my literature reviews, I've encountered how, like, sometimes physicians will assume that a Black mother is on Medicaid. Like, there are a lot of assumptions that are sometimes made. So I don't know. I feel like I want to tackle it from that type of approach, is like the going about it from like educating physicians and encouraging them to, like, encouraging creating an environment for them to do better. And then, but I don't know. I don't really know that I have the answer yet how my training thus far comes into it. And I think that's also part of the reason why I'm taking a year off school, because I want to think more about, like, what's next. You know what I mean? Like, what training do I need still? Like, do I go for my doctorate? Do I go for my master's? Like, there are so many things that I think still are unanswered in terms of how I accomplish the things that I want to accomplish, because I know when it comes to Black maternal mortality, there's so much I don't know.
Mm.
There's so much I don't understand. I've learned a lot, but I'm definitely not an expert by any means. I think a lot of what I relay is definitely more of a lay person experience, lay person knowledge, and things like that. So all that to say, don't take what I'm saying with the what's that saying people say where it's like, take, well, I guess basically take what I'm saying with a grain of salt. But there's also another saying where it's like, don't take me as like the expert, basically, because I'm definitely not an expert by any means. This is just my personal experience with Black maternal mortality and my desire to change the things I can't accept one day at a time.
I'll tell you from an engineering perspective, I focus a lot in construction management. And when it comes to safety and delivering on projects, it really takes a top-down approach where management knows what needs to be done. Management is able to relay these solutions to the next level, and the next level all the way down to like the lowest construction workers. Everybody stays safe. Everybody has the same idea, and that everybody can move forward together. I'm sure it's probably going to be something similar in the
Yeah.
healthcare space.
And yeah, I'm excited to see what it looks like, because that's the biggest thing right now is like, my mom sometimes says, Mary, you do a lot of this. And yeah, I mean, truly, it's a lot of this right now for me. And I think there's definitely still, I have a lot still to learn, a lot still to experience, but I'm open to where my journey takes me. I think senior year me, 2020, would have been like, okay, like I would have like not considered, I would not have stayed at Pitt, basically. I would not have taken the full-time job. I would have just full-fledged ahead, just gone to get some type of master's, gone to get a doctorate. Like, I would have just kept rolling through the motions. I wouldn't have taken the time to fully explore the opportunities that are in front of me. And I think me staying, that's part of what that's doing for me, is exploring the opportunities that are in front of me, not just having blinders, being like, okay, this is how I have to do it. I have the prescription pad in front of me. I have to follow it exactly. Like, no. So I'm really open to where my journey has taken me. If you're listening to this and you have any ideas for where I go next, go ahead and hit me up. And because I'm open to learn, open to grow, open to. It's funny because one of the grads at Regis Jesuit is open to growth. So definitely taking that with me. I'm open to growth. I'm committed to doing justice. That's another one of them. I don't know the other ones. Loving. I think loving is another one. I do think I'm loving. There's a couple other ones that I'm forgetting, but yeah. So
before we close out this
Yeah.
episode, is there anything else you want to get across to everybody watching and listening?
I don't know. Be you always. Be yourself. Don't let, like we said, comparison is
The thief of joy.
the thief of joy. Don't compare yourself to others. Your journey is your journey. Be open to everything that's coming your way. Be grateful. Take moments to soak in the gratitude, give people their flowers, receive flowers, and don't don't let others tell you that you can't do what you want to do. because there will always be a way for you to do what you want to do. Um,
This has been an excellent episode, Mary.
Ian, I'm telling you, it's all you. It's all
I'll
you.
stop. Too much gassing. But y'all, everything Mary will be in the description. Definitely reach out to her on LinkedIn. You'll be able to find a description of this episode, and all other links will also be there as well.
For sure, for sure.
But anyways, y'all, I'm incredibly grateful for everybody who came along for this ride of season 2. Very successful beyond my wildest dreams. You may be receiving some summer content in some way, at least on YouTube. Not exactly sure exactly how it's going to go, but everybody will be updated. Season 3 going to be debuting in the fall, August. Definitely look out for it. And yeah, that's really it for me. Of course, this week we're doing things differently. We're going to go off with our artist spotlight this week. Runaway Woman by Funky Lamp. Also, Funky Lamp will be playing at Flagstaff Hill this Saturday, April 20th. So definitely look out for them. It's going to be an incredible fundraising experience. But anyways, y'all, this is your host, Ian Kahinde, and I'm signing off. See you in the fall. Peace out, everybody.